Hello again. The Correctional Services Department says it has now contained the diphtheria outbreak at Pollsmoor Prison in the Western Cape. One inmate has died and dozens are in isolation, including some prison officials. Now, earlier this year, the National Institute for Communicable Diseases, that is the NICD, issued a diphtheria alert after a child in the Western Cape and an adult in KwaZulu-Natal tested positive for this disease. Let's get some insights now from NICD's and von Gottberg. Prof, good afternoon. Welcome to today and thank you very much for your time. The prison authorities, seemingly things are under control. Apparently there's a big vaccination drive there now and they are getting their numbers up. How important is vaccinating against diphtheria?
It's almost the most important. It's a vaccine-preventable disease, and it's the best way that we have to prevent anyone getting sick. And vaccines are given routinely to infants and to young children as booster doses as part of our routine immunization program. So it's the most important thing to do, is to give the vaccine.
Yeah, pardon my ignorance, but I think for me it's an important question. Do you have to get that vaccine when you are a baby, like when we get measles, polio, and that kind of vaccine stuff? Or do you get it when there's an outbreak?
No, you need to get it routinely as an infant, as a baby. But if by chance you didn't get it for whatever reason, we can give catch-up vaccinations. And so we can look at your vaccination history and say, you didn't receive this vaccine, and it's really important to be vaccinated against this disease. And then we do what we call is catch-up vaccination. And so anyone who's worried, who doesn't know whether they've been vaccinated and wants to assess that should go to their clinicians, their GPs, to any vaccine providers and to have that assessed. So catch-up vaccination is also important. Booster doses are important. And the most important is for guardians and parents to bring their children for their routine immunizations.
Yeah, I understand from the reports we've seen since this outbreak at Pollsmoor Prison that it's close contact. It spreads by close contact, this bacterial infection. So in the rest of the country, how safe are we?
Well, it's close contact, it's respiratory droplets, and I think many people have become experts at respiratory transmission. There's one added type of transmission which is slightly less common, which is from non-healing ulcers or wounds. I think the country is not that at risk, and especially is not at risk if you are vaccinated. What we do worry about is the vaccine coverage. So the number of children that are not vaccinated has increased, mostly because it's been difficult to get to vaccination clinics. There's been the time of the pandemic, which made it difficult. So we think that we are at more risk than we were before because we have lower coverage, and we want every child to be vaccinated against this disease, as well as the other vaccine-preventable diseases. Even if they're in very difficult to reach places, we need to make the effort, and we want to ask the public and parents and guardians also to help us, to meet us halfway, so we can make sure that children are vaccinated against these vaccine-preventable diseases.
Yeah, clearly diphtheria has been around for some time. You, as the NICD, issued a warning about it in the early part of the year when there were some people who tested positive, including a child in the Western Cape. We are heading into holiday season. There'll be movement up and down the country, different places. What would your message be?
So our message is to be aware, to prepare, so to get vaccinated, to make sure that you are vaccinated and have received all your vaccines. And then our message is mostly to present to doctors if you have some of the signs and symptoms, a low-grade fever, a sore throat, a difficulty in breathing, and especially we want to remind clinicians, so the GPs, the doctors, the nurses out there, to remember diphtheria as part of their differential diagnosis, so that we can consider the diagnosis, take the right specimens, process those specimens correctly in the laboratory, and have a diagnosis as quickly as possible. Yeah. I think if we're all working together, then even the holiday season, we should be on top of it, and we should be able to enjoy the holidays at the end of the year.
Yeah. What are chances of misdiagnosis? I'm asking you, you've mentioned fever, sore throats and stuff. I mean, for example, somebody could be having malaria, but then they get diagnosed as a flu if they haven't tested for malaria. Some of the symptoms you've mentioned could be like flu-like symptoms. When do you know it's diphtheria?
So there are one or two things that are very specific or very particular to diphtheria, like a pseudomembrane, this gray, thick membrane that might be in the throat, a very enlarged neck. It's called a bull's neck, and the clinician should remind themselves of all these clinical features. And then the specimen going to the laboratory is the most important thing to help exclude diphtheria. But we want people to not wait for the laboratory. So the clinicians, the doctors treating these patients don't have to wait for the laboratory to give a result, because if they suspect diphtheria, because these signs that I've just described that are quite peculiar and particular to diphtheria, treatment might be needed urgently. And I think that's what we want to try and emphasize, that early diagnosis and early treatment. So suspicion of diphtheria, if we treat that early enough, then we have good outcomes. And we need to think of that on a regular basis, especially for something that's a rare disease and not commonly seen by doctors.
Yeah, especially because it's around now at Pollsmoor Prison. It was around in KZN and Western Cape early this year, so it's still somewhere in the air. So swollen neck glands are a good indicator from what I've heard you say, among other things. Treatment-wise, I mean, from the NICD, we were talking to a lot during the pandemic, COVID-19, and a key feature of that pandemic was lockdown, and if you were positive, you get isolated. Do you get isolated as well in the diphtheria, like they've done at Pollsmoor Prison when they've isolated the inmates and the infected officials?
Yes, and in fact, so as soon as the clinician, the nurse or the doctor suspects diphtheria, they should tell the person to stay isolated, even if they do it at home. And we've all learned how we can do that very pragmatically and practically. Some will be sick enough that they need to stay in hospital and they'll be isolated there. Others could potentially go home if they're well enough and if they have the space and the ability to isolate. And yes, it's very similar. And even contact tracing happens. And in Pollsmoor Prison, that's the way that they contained the outbreak, because they did very careful and intensive contact tracing, where the swabbing of contacts then also helped to identify a few more individuals. And it's a very similar scenario to what we all learned so well with the pandemic.
Finally, Pro, before I let you go, it's a very important discussion. Is there any important question I haven't asked you that you'd like to share with our viewers as we conclude?
Just to emphasize that to give antibiotics and antitoxin, which is the way it's mediated, the disease is mediated not by the bacterium causing so much damage, but the toxin that bacterium makes. And we need to give diphtheria antitoxin. And so we want to do that very, very quickly. And that's why people must present to their clinicians, and clinicians need to think of the diagnosis. And then we will make a difference in preventing severe disease and death.
Thank you very much, Professor Anne von Gottberg of the National Institute of Communicable Diseases. That's the NICD here in Johannesburg.